And an election year is traditionally a time for bold new ideas to be put on the table, and this year is no exception, I should say. Major reviews of Melbourne's bus network are underway, and joining me now is Dr. Danny Davis, the co-author of the Community Transport of the Future report and Managing Director at Link Community and Transport. Dr. Danny, welcome. Thank you so much for joining me in studio.
Thanks for having me.
So let's dive right into this. It's an interesting one. We're looking at the transport, looking to update and considering relating to the improvement of local bus services in growth areas and updating accessibility. Talk to me about how realistic that objective is based on what you've seen.
Yeah, so there's a major review, a major bus strategy underway at the moment, which is seeking to upgrade and update the whole network into something that's more usable for everybody. But there's particular focus, I think, on accessibility. So there's a lot of people who really struggle to access mainstream public transport. That's quite a large cohort. So it involves older people, disabled people, the people we automatically imagine. Lots of people with health conditions, and increasingly with healthcare at home, it's more important for people to be able to continue to access services, medical services, health services, community, etc. But it also comes into what's known as geographic transport disadvantage. Okay. So people living in growth corridors, people further out in rural areas as well, where there's just no transport provision there or inadequate provision. The bus strategy that is coming up has the opportunity to genuinely change that.
Right.
Whether they take that opportunity or not, we're still to find out. But there's been some research done on it. So not just the work I was involved in at University of Technology, Sydney, but there's been some work at Melbourne University looking at changing the grid and having more regular, constant buses going on the main arterial roads. Okay. But a much larger increased role for community transport in all the back streets. Responsive transport, so using technology, Uberization of a bus fleet.
Okay.
Pick you up from home, pick you up from the corner.
Yep.
But interestingly, and for the vulnerable people, that same technology can be used to know what the specific needs of individual users are.
Right.
So when you hail using your app or whatever, it knows if you're in a wheelchair, if you're in a wheelie walker, what support you need, and it sends the right vehicle with the right support crew on board, which may be the same bus that's touring the area. So very responsive to how much demand there is. Yep. It's hopefully an end to large buses trying to get down back streets with nobody on them every 2 hours, which is completely useless to everybody.
Absolutely.
Time for technology to rule. Perhaps.
There you go. Good answer there to start. So what's the difference between assisted community transport and I suppose the public transport accessibility that we know at the moment? You sort of outlined the technology taking over, but take us through a bit about that.
So if you think of mainstream arterial transport, trains, trams and buses, and they are on a journey for accessibility. So there's the raised tram stops, there's improved access to stations, lower gaps between the stations, all good stuff. But that is on the arterial routes. So if you are in a wheelchair, you can't get the 400, 500 metres to the bus. You can't get the kilometre to the train. It's not just about accessibility to the arterial route. It's about having equity of access to services, equity of access to community to overcome the challenges that you have. And the question really is, should public effort be just focused on the mainstream or focus more on the vulnerable?
Which it feels like it has been for a long time, which is what I'm picking up from you. So you're saying people are missing out now, is that correct?
100% people are missing out. And it's in subtle ways. So I think we know about social isolation at home and people really struggling with mental issues at home through the pandemic, but just in general, if they have health challenges, if they have health vulnerabilities, perhaps to COVID, if they have medical challenges and mobility challenges, they're stuck at home, and that is bad for them mentally, it's bad for their health outcomes. But there's more subtle disadvantages baked into the system. So if you or I get on a train or a bus and buy a ticket, we buy a ticket, that's beautiful. It's 90% subsidised through public funding. If an older person gets on a community transport vehicle, it's full cost recovery. So it might be coming out of a package that's government funded, but when that package runs out, and it does, they have to pay the full cost out of their own pocket.
For something that they might not be fully enjoying / able to use.
They can't use the mainstream public transport that is so heavily subsidised, hidden in the background. So there's kind of inequities in the system.
Yeah.
And we're hoping that in this bus strategy and broader public transport thinking, there's government will take the opportunity to try and take some of those barriers to access out and allow there to be equity of access to services for vulnerable people.
Now, I imagine there's an environmental aspect to this as well. Talk to us about sustainability, electricity, how we're going to shuffle and change.
Absolutely. And look, there is a huge focus on electric buses and electric vehicles, which is fantastic, but a little slow.
Yes,
largely because there are, and that's convoluted by global supply chain issues. So trying to get an electric vehicle, even if you just go buy an electric car, you'll be on a 2-year wait.
Yes.
If you're trying to get an electric fleet of buses, it will take a long time. It is coming, it is the right angle, it will happen. But more to the point, if we can reduce people's reliance on the private car,
yes,
if we're using vehicles that are multi-pickup, multi-drop-off, so they're picking people up, they're more of a bus than a car, we're just taking vehicles off the road. We're reducing the demand on creation of the vehicle, the petrol it uses, and the cost to vulnerable families, people living in the more financially challenged growth corridor areas who at the moment have to rely on owning 1, 2, 3, sometimes 4 vehicles to be able to get to work.
Yeah.
There is a huge environmental impact of better public transport.
Absolutely. And Dr. Danny Davis, I want to thank you for joining me on the program. There's a lot more we could discuss on this point, but is there anything you want to say just to finish up for me?
I think probably just in terms of, we're in an election year. I think this is a really popular thing for politicians to lean into at the moment. People again think of public transport as something that's a little bit too hard to tackle, but we're looking at something on a much more local level. And when we're looking broadly across transport disadvantage and people who are increasingly challenged to access public transport, if you just look at the older community, we talk about active retirement, keeping people active, through to palliative care, you're talking about 30% of the population and their families. So this isn't a fringe issue. This is a mainstream issue. This is about how people live their lives, how we all live the lives, how we end up caring for our own parents and keeping them active, healthy, happy for longer. I think there's a real opportunity for them.
Well said by you. And thank you again for joining me in the studio.
Pleasure.